welcome to the deep dive. Today we're diving headfirst into, well, a fascinating intersection of modern veterinary science and age-old animal care. You might picture horse breeding as something very traditional, steeped in history, but as we're about to discover, technology has radically reshaped it in ways you might not expect. Our mission for you today is basically to give you a shortcut to being really well informed on the truly unique world of equine artificial insemination. We've sifted through a stack of detailed sources, quite intricate stuff actually, and we're ready to pull out the most important nuggets of knowledge and insight, hopefully with some surprising facts to keep you hooked.
That's right. Artificial insemination, AI as it's known, hasn't just changed horse breeding, it's fundamentally transformed it. At its core, it's about precisely collecting semen from a stallion and carefully depositing it into a mare's uterus. So it completely removes the need for direct physical contact. It really showcases how, meticulous planning and scientific know-how can open up some really powerful new opportunities.
Okay, let's start by unpacking this a bit. What exactly spurred this shift? Why did AI suddenly become such a pivotal thing in horse breeding?
Yeah.
What were the big drivers?
Well, the reasons are incredibly compelling. There are quite a few, actually. Firstly, there's a huge focus on safety.
Safety.
Yeah, natural breeding or live cover, it can be quite dangerous for both the mare and the stallion. So AI dramatically reduces that risk of injury.
Okay, that makes sense.
Then there's disease control. It's a powerful shield against venereal diseases. Stallions can be thoroughly screened, semen processed under incredibly sterile conditions, much cleaner.
Right, so safer and cleaner. That seems logical. But where does it get really interesting for the breeders? What's the big pull?
This is probably the biggest game changer, genetic access. AI just rips down geographical barriers.
How so?
Mare owners can tap into genetics from stallions located, well, literally anywhere in the world.
Anywhere, wow.
Yeah, anywhere. This includes stallions that are actively competing, maybe those with physical limitations that prevent natural breeding, or even those who are deceased.
Deceased stallions. How does that work?
Thanks to frozen semen, we'll get into that a bit more later, but yeah, the possibilities are huge.
That global reach sounds truly revolutionary. So essentially, a stallion's genetic influence becomes almost boundless, not tied to where he physically is.
Precisely. And think about it from the stallion owner's perspective, too. It offers incredible utilization efficiency.
Meaning?
Meaning a single ejaculate, one collection, can be extended, diluted, and divided into multiple breeding doses. This means one stallion can breed many, many more mares in a season, potentially 120 or more with AI, compared to maybe 40, 80 with natural cover.
That's a huge difference.
Massive. Plus, it's fantastic for mare management, especially for mares with physical issues or maybe temperament issues, mares that are simply difficult to breed naturally. And of course, a big one. It removes the stress and the significant cost of transporting mares long distances, sometimes across continents, just for breeding.
Okay, that paints a really compelling picture of AI's benefits. Safer, wider access, more efficient.
Yeah.
But in a process this sophisticated, there must be a flip side, right? What are the practical challenges, the drawbacks?
Absolutely. It's revolutionary, but AI isn't without its complexities and drawbacks. You're definitely looking at much more intensive veterinary involvement.
Veterinary visits.
Way more. You need constant monitoring of the mare cycle, which translates directly to higher professional fees. So the overall cost can easily exceed natural cover. You've got those vet fees, semen shipping expenses, specialized equipment needed. It adds up.
Right.
And then there's the absolute criticality of timing. This is huge, particularly with cooled and especially frozen semen. Precise timing is paramount for success.
Making it quite labor-intensive, I imagine.
Very labor-intensive. And despite improvements, pregnancy rates per cycle with frozen semen are generally a bit lower compared to using fresh or chilled semen. That's improving, but it's still a factor.
Okay.
And perhaps the most significant constraint for some breeds, a really important one. Certain prominent breed registries, like the Jockey Club for thoroughbred racehorses, completely prohibit AI, full stop.
So it's not even an option for some of the major breeds. That's a big limitation.
Exactly. Thoroughbreds must be bred by natural cover only.
Okay, so when we talk about AI, you mentioned different ways the semen is handled. It's not just one thing. How does that choice, fresh, cooled, frozen, how does that profoundly reshape the whole breeding strategy?
Yeah, understanding these three main types is fundamental. It dictates so much of the process. First, we have fresh semen.
Okay, fresh. Sounds straightforward.
It pretty much is. This is semen collected from the stallion and used almost immediately, usually within a few hours. There's minimal processing beyond maybe filtering out the gel part. It's most common when the mare and stallion are physically at the same facility, same farm, same clinic.
And the advantage there.
It boasts the highest fertility rates, generally the best pregnancy outcomes, and the sperm have the longest lifespan once inside the mare's reproductive tract.
But the limitation is obvious.
Very limited logistical flexibility, yeah. Both animals have to be in the same place at the right time.
Okay, so if they're not in the same place...
Then you look at cooled or chilled semen. This is probably the most common method used for shipping semen domestically.
Cooled? How does that work?
So the semen is collected, then it's diluted with something called an extender.
An extender.
Yeah, it's like a special nutrient broth for the sperm. It contains sugars for energy, antibiotics to prevent bacterial growth, and often cryoprotectant substances that help protect the sperm cells from damage during the cooling process. It's then slowly, carefully cooled down to about 4 to 6 degrees Celsius, refrigerator temperature basically, and it's shipped typically overnight in a special insulated container.
How long does it last?
It's typically viable for use within 24 to 48 hours after collection.
So that opens things up quite a bit.
Oh, absolutely. It's widely used for shipping semen over distances, allowing breeding to stallions not on the mare's premises. It offers pretty good fertility rates, much better than frozen usually, and significantly more logistical flexibility than fresh. You avoid the stress and cost of shipping the mare.
Downside.
Well, it still has a limited viability time, that 24 48 hour window.
Yeah.
It requires reliable overnight shipping, which can sometimes be tricky. And it's very sensitive to temperature fluctuations during transport. If it gets too warm or too cold, the quality plummets. And you need to ship a large number of sperm, typically aiming for at least 500 million progressively motile sperm remaining at the time of insemination.
Right, so you need a good quality ejaculate to start with.
Definitely. And that brings us to what sounds like the ultimate long-distance, long-term solution. Frozen semen.
The indefinite storage option.
Exactly. Here, the collected semen is extended, then it undergoes cryopreservation. It's frozen in liquid nitrogen at an astonishingly low temperature, minus 196 degrees Celsius or minus 321 Fahrenheit.
Wow.
Yeah. It's stored in small plastic straws, like tiny cocktail straws, immersed in liquid nitrogen tanks. And it can be stored that way, theoretically, indefinitely, years, decades.
So this is the key for international breeding, or using deceased stallions.
Precisely. It's the gold standard for international movement of genetics, accessing genetics from deceased stallions, or just when fresh or cooled semen isn't logistically feasible for whatever reason. It offers unparalleled long-term storage and global access. The semen is right there, ready to be thawed exactly when the mare ovulates.
But I sense a but coming.
There's always a but, isn't there? It generally has the lowest per cycle pregnancy rates compared to fresh or cooled semen.
Lower success rate.
Yes. And it demands incredibly precise timing of insemination, even more so than cooled. It requires greater veterinary expertise for handling and thawing the straws correctly. And a really important point. Not all stallion semen freezes well. Some stallions just have sperm that don't survive the freeze-thaw process effectively.
So it's not a guarantee even if the stallion is available.
Not at all. And post-thaw, the sperm's longevity inside the mare is severely reduced. We're talking maybe only 6 to 12 hours of viability.
Only 6 to 12 hours. That's a tiny window.
It's incredibly tight, which leads us nicely into the actual procedure.
Right. Having grasped the powerful why behind AI and the different, forms of semen, let's now peel back the layers on the actual procedure. This isn't just one quick event, is it? It sounds like a meticulously choreographed journey, often guided by an experienced equine vet.
That's exactly right. You can't overstate the importance of precision and careful management. The success of AI really hinges on it, start to finish. It all begins, really, with intensive mare management and cycle monitoring.
Before you even think about ordering semen.
Way before. Before the breeding season even properly starts, ideally, a veterinarian performs a thorough reproductive exam on the mare. This includes palpation, feeling the uterus and ovaries through the rectal wall, and ultrasound imaging. They're assessing the health of the reproductive tract, looking for any abnormalities like cysts or fluid, maybe taking uterine cultures or biopsies if there's a history of problems, or if she's an older mare.
So problem mares need more upfront work.
Definitely. Older mares that have had trouble conceiving before, they often require much more intensive evaluation and potentially treatment before you even start trying to breed them.
Okay, so assuming the mare gets a clean bill of health, what's next? Tracking the cycle.
Exactly. Then the mare's estrus cycle, her heat cycle, is closely tracked. There are two main ways this is done. One is teasing. This involves introducing the mare to a stallion. Often it's actually a gelding used as a teaser, just to observe her behavior. Signs of estrus include things like winking the vulva, squatting, tail raising, receptive behaviors.
Traditional method.
It is, and still useful, but it's usually combined with the more scientific method, frequent rectal palpation and ultrasound. The vet examines the mare frequently, sometimes daily or every other day as she gets closer to ovulating. They're monitoring the development of follicles on the ovaries, looking for a dominant follicle to reach a certain size, typically 35 millimeters or greater. They also check for changes in the uterus like edema or swelling patterns and relaxation of the cervix. All signs she's approaching ovulation.
Daily checks. That sounds intense.
It can be, especially as ovulation nears. Once a dominant follicle reaches the right size, say 35-40 millimeters, and the mare is showing clear signs of estrus, both behaviorally and on ultrasound, the vet will often administer an ovulation induction agent.
A hormone shot.
Yeah, usually a hormone like HCG or dyslorelin. These drugs help to predictably time the ovulation, makes planning the insemination much more accurate. Ovulation typically occurs within 24 to 48 hours after giving the shot.
Okay, so you're basically controlling when she'll ovulate within a fairly narrow window.
That's the goal. Precision.
That's a huge level of oversight, like coordinating a small orchestra, isn't it? Daily checks, specific timing. I imagine equine vets become master schedulers during breeding season.
They certainly do. It's all about timing.
So that brings us to the actual semen handling and insemination. How is the semen collected and prepared, and then how does it, get where it needs to go in the mare?
Okay, let's break that down. First, semen collection on the stallion side. The most common method uses a specialized artificial vagina, or AV. The stallion has to be trained safely to mount a phantom, which is basically a padded dummy or sometimes a live teaser mare. His penis is then directed into the AV by a handler. The AV is designed to mimic the temperature and pressure of the mare's vagina to stimulate ejaculation.
Okay.
The ejaculate is collected into a container attached to the AV. It's immediately taken to the lab and filtered to remove the gel fraction, which is part of the ejaculate but doesn't contain many sperm and any debris. Then, the raw semen is evaluated under a microscope, looking at volume, sperm concentration, count, motility, what percentage are swimming forward progressively, and morphology, what percentage have normal shape.
A quality check.
Absolutely critical. Based on that evaluation, it's then diluted with that specialized extender we talked about earlier. The extender provides nutrients and protects the sperm during cooling or the freezing process. If it's being frozen, it's packaged into those small straws, slowly cooled in stages, and then finally plunged into liquid nitrogen for long-term storage.
Got it. And then on the mare's side, for the insemination itself, what does that look like?
Hygiene is paramount here. You absolutely want to avoid introducing any bacteria into the uterus. So the mare's perineal area around the vulva is thoroughly cleaned and disinfected. Her tail is usually wrapped or tied out of the way to prevent contamination. The veterinarian then puts on a sterile, shoulder-length glove, lubricates it, and carefully inserts their hand into the mare's vagina. They manually guide a long, sterile insemination catheter or pipette through the mare's cervix and just into the uterine body.
Wow, a hands-on process.
Very much so. Once the catheter is in place, the syringe containing the semen, whether it's fresh or warmed chilled semen or a carefully thawed frozen semen, is attached to the end of the catheter, and the semen is slowly and gently deposited into the uterus.
And you mentioned a special technique for frozen semen, deep horn.
Yes, deep horn insemination, or DHI. Because frozen thawed sperm have such limited motility and lifespan, and because the dose is often smaller, this technique is often used. Instead of just depositing the semen in the uterine body, the vet guides the pipette further, right into the uterine horn that's on the same side as the ovary, with the large preovulatory follicle.
So closer to where the egg will be released.
Exactly. It shortens the distance the sperm have to travel and theoretically maximizes the number of sperm that reach the site of fertilization in the oviduct. Gets them closer to the target.
Okay, that makes sense. You mentioned precise timing earlier, especially for frozen semen. Can you walk us through why that precision is so crucial? How does it differ based on whether the semen is fresh, cooled, or frozen? This seems like the absolute key.
It really is one of the most vital aspects of the whole thing. As I said, semen longevity varies hugely depending on how it's preserved. And the equine egg, the ovum, it has a very short viable lifespan after ovulation, maybe only 8 to 18 hours. It's a small window.
Okay, 8 to 18 hours for the egg.
Right. Now, for fresh semen, because the sperm can live quite a long time in the mare's tract, sometimes 48 hours or even more, the timing is less critical. Insemination can ideally occur anytime from 48 hours before ovulation up until just before ovulation. The goal is simply to have healthy, viable sperm waiting in the oviduct when the egg arrives.
The more wiggle room with fresh.
Definitely. Now, with cooled semen, the sperm lifespan is shorter, remember, maybe 24 to 48 hours total, and likely less once inside the mare, so you need to time it more closely. Insemination typically occurs within the 24 hours prior to the predicted ovulation time. Often, mares are inseminated the day after receiving that ovulation-inducing agent, aiming to hit that window just before ovulation occurs.
Okay, tighter than fresh, and then frozen. That sounds like where it gets really intense.
It absolutely is. Frozen semen demands the most intense timing and management. Because, as we mentioned, thawed frozen sperm have such a short functional lifespan in the mare. Estimates vary, but it's often cited as around 6 to 12 hours.
Just 6 to 12 hours.
Yeah. So the insemination needs to happen very close to the actual moment of ovulation. The ideal window is considered to be from about 6 hours before ovulation up to 6 hours after ovulation.
That's incredibly precise. How do they even manage that?
It often requires multiple ultrasound examinations of the mare per day, sometimes every 4 to 6 hours, as she gets very close to pinpoint ovulation as accurately as possible. And sometimes, depending on the vet's protocol and the stallion's semen characteristics, the mare might even be inseminated more than once per cycle, say once before expected ovulation and once just after it's confirmed.
It's stressful for everyone involved.
It can be. Some protocols use timed insemination, like inseminating at 24 and 40 hours after the HCG shot, hoping to bracket the ovulation time. But the most successful approach generally is intensive monitoring and inseminating very close to the detected ovulation.
Makes sense. So once the insemination is done, hopefully timed perfectly, what's next? You don't just turn the mare out to pasture and hope for the best, I assume?
Not at all. There's crucial post-insemination care and monitoring. It's not over yet. Usually the mare is re-examined via ultrasound about 24 hours after the insemination.
What are they looking for then?
Two main things. First, to confirm that ovulation has actually occurred. Second, to check for any excessive fluid accumulation inside the uterus. Breeding, even AI, causes some inflammation, and some mares don't clear this post-breeding fluid effectively. This condition is known as delayed uterine clearance, or DUC.
And that fluid is bad.
It can be very bad for establishing a pregnancy. It creates a hostile environment for the embryo. So, if significant fluid is detected, the mare may receive treatment.
Like what?
Common treatments include uterine lavage, basically flushing the uterus with sterile saline solution to wash out the fluid and inflammatory debris, and or giving injections of oxytocin, a hormone that makes the uterus contract and helps expel the fluid. This is especially common and often necessary in older mares or known problem mares.
Right, managing that immediate post-breeding phase is key.
Absolutely. You want the uterus clean and quiet for the embryo to develop.
Okay, and then the exciting part. Pregnancy diagnosis. When do breeders finally get to know if all this meticulous work, the timing, the checks, has it paid off?
Yes, the moment everyone waits for. The first pregnancy check via ultrasound is typically performed around 14 to 16 days after ovulation.
That early. What can you see then?
You can usually detect a small, spherical, fluid-filled structure, the gestational vesicle, the very early pregnancy. It's tiny, maybe the size of a marble. This 14-16-day check is also critical for another reason: detecting twin pregnancies.
Twins are bad in horses.
Generally, yes. Mares are not really designed to carry twins to term successfully. Twin pregnancies have a very high risk of abortion or resulting in weak, non-viable foals, and it's dangerous for the mare, too. So if twins are detected at this early stage, the vet can usually intervene.
How?
By manually pinching or crushing one of the vesicles. It sounds harsh, but it's a standard procedure done very early on to reduce the pregnancy to a single, much safer one.
Got it. So first check at 2 weeks for pregnancy in twins, then what?
Then there's usually a second pregnancy check around 25 to 30 days post-ovulation. By this time, you can usually see the embryo proper within the vesicle, and crucially, you can detect a heartbeat via ultrasound, confirming viability.
Seeing the heartbeat must be a relief.
Huge relief, and often a final check is done around 60 days. This is sometimes tied to payment schedules, like a live full guarantee fee might become due from the mare owner to the stallion owner around this point. And beyond these initial checks, of course, it becomes about meticulous ongoing care throughout the mare's gestation, which is long, about 11 months, roughly 330, 340 days. This covers everything from proper nutrition, regular health checks, specific vaccinations at key points like for equine herpes virus at 5, 7, and 9 months, and deworming protocols. And one practical thing. If the mare had a Caslix procedure done,
A Caslix, what's that?
it's a minor surgical procedure where the upper part of the vulva lips are stitched together. It's often done in breeding mares, especially older ones or those with poor conformation, to prevent contamination of the vagina and uterus with air or feces, which can cause infections.
Oh,
If a mare has a Caslix, it must be surgically opened again before she foals, otherwise she'll tear badly during birth. So that's another management point.
right. Lots to manage, even after she's confirmed pregnant. That makes perfect sense. So with all this intense focus on the exams, the tracking, the post-breeding care, what does this all mean for the stallion? The other half of this equation, it's not just about showing up for collection day, is it?
Absolutely not. Stallions involved in an AI program require specific, dedicated care and management. It's just as important to ensure optimal semen quality and, crucially, safe collection procedures.
So what does that involve?
Well, first, a thorough annual breeding soundness examination is essential. Just like the mare, the stallion gets a full reproductive checkup. The vet evaluates his reproductive organs, general health, and screens for important venereal diseases.
Like which ones?
Key ones include equine viral arteritis, or EVA, contagious equine metritis organism, CMO, that's a nasty bacterial one, and equine infectious anemia, EIA, which is tested for with a Coggins test. Ensuring the stallion is disease-free is critical for biosecurity.
Makes sense. What else?
Then there's the practical side, training for AV collection. Stallions have to be safely trained to mount a phantom mare or a teaser mare and deposit semen into the artificial vagina. This takes time, patience, and really requires an experienced, confident handler. Safety for both the stallion and the handler is paramount.
I imagine some stallions take to it better than others.
Oh, definitely. Temperament plays a big role. And regular semen evaluation is crucial throughout the breeding season. You don't just check once. You monitor the concentration, motility, morphology regularly to track his fertility and make sure the quality is holding up.
So it's really about their overall physical and reproductive fitness, much like with the mares.
Precisely. Good nutrition and exercise play a significant role. A well-balanced diet and regular but not excessive exercise contribute to overall health and consequently semen quality. You don't want them too fat or too thin. And biosecurity at the collection facility is non-negotiable. Strict protocols must be maintained to prevent the spread of infectious diseases between stallions or to the mares being bred. Ideally, each stallion should have his own dedicated AV and collection equipment, or at the very least, disposable liner should be used for the AV for every collection.
Right, preventing cross-contamination.
Exactly. And another factor is seasonality. Like mares, stallions are naturally seasonal breeders, most fertile during longer daylight hours. So for stallions breeding early or late in the season, photoperiod management using controlled artificial lighting to simulate long summer days can help maintain optimal semen production.
Using lights to keep them in season.
Essentially, yes, it helps keep testosterone levels and sperm production up. One other point. For stallions that aren't collected very frequently, say only once a week or less, clean-out ejaculations might be necessary.
Kino!
Yeah. Sperm is stored in the epididymis before ejaculation. If a stallion isn't collected regularly, older, potentially less viable sperm can build up. So performing 1 or 2 collections just to discard the semen before collecting the actual dose intended for breeding can help ensure you're getting the freshest, highest quality sperm for insemination.
Okay, that makes sense. Get rid of the old stock first.
Basically, yeah.
So if we connect this to the bigger picture, trying to optimize everything, it sounds like there are ways to push the boundaries even further in terms of efficiency and success, especially when dealing with that really valuable or maybe limited quality semen we talked about. How do breeders maximize those precious drops?
That's a great question, and it leads into some more advanced techniques. How can we be as efficient as possible, especially with semen from very valuable stallions, or maybe stallions whose semen doesn't freeze well, or where the dose quantity is limited? Low-dose insemination, LDI, is really the main answer here.
Low dose, using less semen.
Significantly less. This technique allows the use of drastically reduced numbers of sperm per dose, whether it's fresh, cooled, or frozen semen. Sometimes we're talking as low as just 1 to 3 million progressively motile sperm, compared to the hundreds of millions used in a standard dose, especially for cooled semen.
1 million. That's tiny. How does that even work?
It works because the semen is deposited much closer to the target. These very small volume, low sperm number doses are typically deposited using either hysteroscopic insemination or that deep horn insemination DHI technique we mentioned earlier. With HI, a flexible endoscope, a small camera is passed through the cervix into the uterus. The vet can visualize the opening of the oviduct on the side where the mare is about to ovulate and deposit the tiny semen dose right at that opening.
Wow, incredibly precise.
Extremely. DHI, as we discussed, uses a specialized catheter guided manually or sometimes with ultrasound guidance to place the semen deep in the uterine horn near the uterotubal junction, again, very close to where fertilization occurs.
And the advantage is,
The huge advantage is that you dramatically reduce the journey the sperm have to make, and you need far fewer sperm to achieve fertilization because they're placed right where they need to be. It increases the efficiency of sperm use incredibly. It's invaluable for conserving precious semen or using semen that might otherwise have poor fertility with standard AI.
is one method better than the other? HI versus DHI.
HI is perhaps slightly more precise because you can visualize the target, but it requires expensive endoscopic equipment and specialized skills, so it's generally more costly. DHI is often more accessible and less expensive, and still highly effective for low-dose insemination.
Okay. And beyond LDI, what other sort of advanced diagnostics or considerations come into play, especially when you're pushing the boundaries like this?
Well, mare selection becomes even more critical, especially if you're using techniques like LDI, or if you're dealing with frozen semen, which is inherently more challenging, or semen of suboptimal quality.
Meaning you want the most fertile mares for the trickiest situations.
Exactly. Young, healthy mares, maiden mares, those who haven't had a foal before, or pluriparous mares, those who've had multiple foals easily, generally have higher intrinsic fertility rates than older mares, or barren mares that have struggled to conceive. So you'd ideally use your best, most fertile mares when working with compromised semen or low doses. Also, thorough pre-breeding screening, like uterine culture and cytology, looking at cells from the uterine lining, is highly recommended for pretty much all mares except maybe very young, healthy maidens, just to rule out any low-grade infections or inflammation that could compromise fertility, especially before investing in expensive semen or procedures.
Makes sense to optimize the mare's side as much as possible.
Absolutely. And it's worth remembering, the entire process, from stallion collection to mare insemination and pregnancy, is prone to potential complications or errors at every step.
Like what kind of things can go wrong?
Oh, lots. Improper preparation or handling of the artificial vagina, incorrect semen evaluation leading to inseminating a poor dose, damage during cooling or shipping, errors in thawing frozen semen, the vet's skill in passing the catheter cleanly through the cervix, potential uterine infections post-insemination. Even simple things like misidentification of stallions or mares or semen straws.
Wow, so many variables.
So many variables. Every single step requires meticulous attention to detail and skill. Vigilance is key.
What an incredible deep dive. The biggest takeaway for me, thinking about all this, might be just how much this isn't simply breeding from a distance. It's really a masterclass in biological management, almost engineering, where every single step from a tiny follicle's growth on our ovary to a single sperm's journey is meticulously monitored and, well, orchestrated.
Indeed, that's a great way to put it. It truly requires incredibly close collaboration and communication between the mare owner, the stallion owner or manager, and an experienced equine veterinarian who really understands all these nuances. But when it is properly executed with attention to all those details, it is a highly effective, powerful method for achieving pregnancies, for advancing equine genetics across breeds and disciplines, and for preserving invaluable bloodlines, sometimes for generations to come.
So what does this all mean for you listening to this? Consider how this level of technological intervention in reproduction really highlights our ambition, perhaps our drive, to not just manage, but to truly optimize the natural world around us. We've seen how precise science can push the very boundaries of what's possible in animal breeding. How might this drive for optimization, this level of control we see in equine genetics, maybe inspire or inform similar advancements in other species? Or perhaps even unlock new potentials in broader biological fields we haven't even considered yet? Something to think about.